Did you hear that?
Yes.
Yes.
Great stuff. So, thank you, everyone. And before I start introducing our speaker for tonight, which is Dr. Kate Hallsworth, I'd like to celebrate with Peter Nyland his gold medal from the recent transplant games. And I can see you wearing it, Peter. Can you hold it up to see? That's great. Thank you very much. That's a British Transplant Games gold medal, World Transplant Games gold medal. Thank you very much, Peter. Brilliant. Congratulations. So we did actually sponsor the World Transplant Games. We sent a bit of money, as you probably know. Right. Our speaker tonight is Dr. Kate Hallsworth, who we've known for a long time. She doesn't look old enough, but she is. And she's been doing some great research into mainly non-alcoholic fatty liver disease and how exercise can help improve outcome since, believe it or not, 2011. And she's done about more than 20 papers, and she's been principal investigator on several, and if not principal, she's been an investigator, and she's highly respected as a physiotherapist. She's a senior research physiotherapist and a clinical lecturer. She works at the Newcastle University and the Newcastle hospitals, and that's not just the Freeman. There's the Freeman, there's the RVI, and there's the what's the one, Yvonne? Presta Clinic. It? Excellent. So Kate got her qualification. She got a bachelor's in Northumbria, and then she went on to do her PhD at Newcastle University, which we all know is the very best university in the country for clinical excellence. Okay, so I'll hand over to you, Kate. I don't know if you've got any lecture slides or...
Yeah, so thanks, John. I'll try my best to share my slides. It says host disabled participant screen sharing at the moment.
Yeah, I'll put it on now.
Let's have a go.
Is that it?
Yeah.
Anyway, welcome, Kate, to your Liver North fans.
Thank you. Let me just get it on slideshow.
I'm just letting another couple of people in.
Yeah, no problem. So thank you all for having me at this this summer meeting. I hate to say summer when we look at the weather outside, but thanks ever so much for the opportunity to come and speak to you all. So as John says, my name's Kate. I'm a physiotherapist by background, and I work between Newcastle hospitals and Newcastle University. And I do a little bit of teaching at Northumbria University to the physio students over there. So I'm going to talk about physical activity, exercise, and non-alcoholic fatty liver disease, or NAFLD, or now, as it's been renamed, kind of metabolic dysfunction associated steatotic liver disease, which is a bit of a mouthful. So I'm going to stick with NAFLD for this evening, if that's okay with everybody. So just to give a little bit of background as to why lifestyle interventions are important for people with NAFLD. So there are currently still no approved drugs to specifically target NAFLD, and lifestyle interventions really do remain the cornerstone of NAFLD management. And weight loss has been shown to be effective, not only improving liver biochemistry, but also liver fat, inflammation, and fibrosis. And it's also important to remember that weight loss also reduces cardiovascular disease and type 2 diabetes risk if you have NAFLD, which is important as actually only 9% of people with NAFLD will die a liver-related death, compared with 38% that will die from cardiovascular disease.
Wow.
But we all know that weight loss is difficult to achieve and sustain in the long term. So another important tool in our armory is physical activity and exercise. And these have been shown to improve liver health independent of weight loss, and are really important tools for those patients that are struggling to lose weight, or also to help people to keep the weight off once they've lost it. And again, importantly, physical activity and exercise reduce cardiovascular disease and type 2 diabetes risk if you have NAFLD. So lifestyle interventions have multiple health benefits for patients with NAFLD beyond that of just treating the liver. So let's have a quick look at what the clinical guidelines say. So the American Association for the Study of Liver Disease, or ARSLD, their clinical practice guidance states that weight loss generally reduces liver fat, and it can be achieved either by calorie restriction alone or in conjunction with increase in physical activity. They also highlight that combination of calorie-restricted diet and moderate intensity exercise is likely to provide the best likelihood of sustaining weight loss over time. They acknowledge that exercise alone in adults with NAFLD may prevent or reduce liver fat, but they do highlight that there is a gap in the evidence looking at the impact of exercise on liver inflammation and fibrosis, so more research is needed in this area. The European Clinical Practice Guidelines, or the EASL guidelines that some of you may be a little bit more familiar with, they recommend aerobic or resistance exercise as they acknowledge that they both effectively reduce liver fat, and highlight that the choice of training should really be tailored based on your patient's preferences to allow it to be maintained in the longer term. They also recommend structured programs for everybody with NAFLD aimed at lifestyle changes towards healthy diet and habitual physical activity. So physical activity and exercise are a key part of the clinical management for patients with NAFLD alongside weight loss and dietary change. But what's the difference between physical activity and exercise? So physical activity is any activity that requires you to use more energy than resting, and it incorporates most of the activities that you carry out as part of your day-to-day routine. So things like housework, gardening, walking up or down stairs would all be classed as physical activity. Exercise is a subcategory of physical activity, which is more planned, it's structured, and includes repetitive movements that are really performed to maintain or improve an element of fitness. So the most commonly studied types of exercise in relation to NAFLD are aerobic and resistance training. So aerobic exercise, sometimes called cardio, is the type of exercise that helps to improve the fitness of your heart and lungs. It generally uses large muscle groups and is normally carried out for at least 10 minutes at a time. Resistance exercise aims to strengthen the muscles and tone the muscles and increase your muscle bulk. And this includes things like lifting weights, using resistance bands, or using your body weight as a resistance tool. So physical activity is kind of a broad continuum that includes active living at one end and active sport or exercise at the other. But if you can increase your physical activity levels in any of these domains, it will really help you if you have NAFLD. So if we go on to look a bit more closely at the data pertaining to physical activity and NAFLD, we know that people with NAFLD spend more time sedentary than healthy controls, and that's around about 5 hours extra sedentary time per week. And when we're talking about sedentary behaviours, we're talking about those behaviours where you're normally sitting down or lying down and that require a low level of energy expenditure. Each additional hour of sedentary time per day that you accumulate is associated with a 1.2% increase in liver fat. The data also shows that 80% of people with NAFLD do not meet recommended physical activity guidelines. And it also shows that low physical activity is associated with a greater risk for disease progression. So you're more likely to progress from the kind of milder end of the spectrum of NAFLD only to NASH, liver fibrosis, and onto cirrhosis, or more likely to develop extrahepatic cancers if you have low physical activity levels. And the data also shows that cardiorespiratory fitness predicts mortality in NAFLD, and people with NASH have a lower cardiorespiratory fitness than the general population. So as a healthcare professional managing people with NAFLD, I should be trying to target these three kind of domains. So trying to help you to reduce your sedentary behaviour, trying to help you to increase your physical activity levels, and trying to help you to improve your cardiorespiratory fitness, which may require more of a structured type of exercise program. So So when we look at the physical activity data for people with NAFLD, we find that people with NAFLD take less steps per day than healthy controls. And this was a study we carried out in Newcastle back in 2015. And we found that people with NAFLD took around about 1,700 steps per day less. And over the course of the week, that totted up to around about 6 miles that they were walking less. They also spent more time inactive or sedentary and less time performing physical activity of any intensity each day that we studied. So I've just included these two physical activity profiles just to demonstrate kind of pictorially what we're talking about. So on the left, you've got a 63-year-old female without NAFLD, and on the right, you've got a 63-year-old female with NAFLD. And along the x-axis is a 24-hour period of time. So you can see that the lady with NAFLD, when she gets up in the morning, the red peaks represent energy expenditure, the green peaks represent step count. You can see that she is pretty much on the go from the minute she gets up to the time when she goes to bed in the evening. And if you compare that to the person with NAFLD, you can see it's much more of a flat line with much less in terms of physical activity peaks and much lower step count. So for people with NAFLD, it's not only important to reduce the total amount of sedentary time that you accumulate each day, it's also really important to try and break up that sedentary time with short bouts of physical activity. So simply just breaking up your sitting time with maybe standing for a minute or two can really help to improve your metabolic control. It can help reduce your risk of heart disease and reduce your risk of developing diabetes. So what type of exercise should you be doing if you have NAFLD? So this was a systematic review carried out a fair few years ago now, back in 2017, and it looked at those studies that looked at exercise on its own. So it didn't include the studies that included diet and weight loss. It was purely the effect of exercise on its own. And they found that exercise could reduce liver fat in the region of 20 to 30%. They found that aerobic exercise was slightly more beneficial in terms of reduction in liver fat, but resistance exercise was also impactful. And the beauty of resistance exercise or strength training is that it requires a much lower cardiorespiratory demand or a much lower level of baseline fitness for you to be able to undertake strength training exercises. So it might be that this is a really good starting point if you're not used to undertaking a kind of structured exercise program. And the beauty of this data really just highlights that actually it doesn't really matter what type of exercise you do in relation to your NAFLD. It's about picking something that you're willing to try, hopefully something that you might enjoy, but something that you can continue in the long term. So it gives you an option of the different types of exercise program to give a go at. And I've just included this slide really to highlight that NAFLD really is a multi-system disease, and that most patients with NAFLD have lots of other comorbidities. So it's important for us as healthcare professionals really to try and develop physical activity or exercise programs, taking all these other comorbidities into consideration. So it's not just targeting you and your liver, it's thinking about maybe your other musculoskeletal conditions. It's thinking about whether you're frail and at risk of falls, and taking that all into consideration when we're talking about an exercise package with you. And there are lots and lots of other health benefits of becoming more active if you have NAFLD. So you will see an improvement in your cardiorespiratory fitness if you exercise regularly. You can see a reduction in your blood pressure. You can improve your glucose control, and you can improve the way that your body handles fats. Exercise and physical activity are also really good for helping to manage mental health conditions. So they can help to reduce anxiety, depression, they can help to improve your mood and your energy levels, help you to sleep better. And this all helps to improve self-esteem and self-confidence. So it has marked impacts on mental health. And then in terms of musculoskeletal health, you will see if you perform exercise regularly, you can see an improvement in muscle strength, muscle bulk, your bone density improves, and you can see your flexibility improves. So you can see there's lots of other health benefits beyond that of just reducing liver fat for taking part in regular physical activity and exercise. And importantly, if you are trying to lose weight as part of your treatment plan for your NAFLD, exercise can help you to maintain that weight loss in the long term. So how much exercise and physical activity should you be aiming for each week if you have NAFLD? Well, the guidelines would suggest that you should be aiming for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity exercise. And I'll talk about exercise intensity in a second. So examples of that would be maybe jogging, brisk walking, and cycling. They also recommend strength training on at least 2 days per week. But the key thing with all of this is that any exercise advice or any exercise prescription should be individualized to you to promote the adoption and long-term adherence. One size really doesn't fit all. So it's all about finding something that matches your kind of goals and that meets your personal preferences. And it says, as it says there, set yourself an achievable goal and try and gradually build up to this. The more physical activity and exercise you can do, the better. And this is just kind of the General Chief Medical Officer for the UK's physical activity guidelines. And you can see they very closely mirror what is recommended for people with NAFLD. Again, you can see the 150 minutes moderate intensity exercise per week or the 75 minutes vigorous intensity per week, builds in some strength training on at least 2 days per week. And they also talk about minimizing sedentary time and breaking up periods of inactivity. They also started to recommend balance exercises for older adults to reduce the chance of frailty and falls on at least 2 days a week. But the overarching message coming from the guidelines is really that every minute counts, some is good, more is better, and it's never too late to start. So when we're thinking about intensity of exercise, as the intensity increases, it is normal for your heart rate, your breathing rate, and your energy consumption to also increase. But intensity of exercise is very personal to you. It's relative to each individual person. So what may be moderate for one person may be very vigorous for another. So it's important to kind of map the intensity to your level of fitness. If you're aiming to do moderate intensity exercise, we often use what we call a talk test. And if you're doing moderate intensity exercise, you can still talk, you can reasonably speak in full sentences, but you couldn't sing. If you're performing vigorous exercise, you can probably utter a few words, but you can't speak in full sentences. So it's a really quite a nice way of working out where you're sitting on this intensity kind of spectrum. So who gains the most from increasing physical activity levels? Well, the good news is the people that are most sedentary and that do the least activity gain the most from increasing their physical activity levels just a little bit. So even if you start to increase your physical activity levels by a few minutes every day, you will see health benefits. So greatest gains are in those who go from doing nothing to doing something. If you already do a lot, that's brilliant, but you get less of a gain in terms of health benefits because you've already gained that when you've moved from a lower level of activity to higher levels of activity. So where are you going to start with all this? A good place is just to think about what you currently do. So you really want to capture a baseline measure. And it's worth considering what you do at home, if you work, what you do at work, and what you do in your leisure time. And thinking about whether you spend large parts of the day sitting. If you work, what does your work involve? Is it quite physical, or are you sitting at a computer all day? How far can you walk at the moment? Can you manage, say, 200 yards? Can you manage 10 minutes? And if you do count your steps, either on a phone or on a physical activity tracker, what do you do kind of on average at the moment? So you've got a starting point, you know where you're working from, and you can start to kind of track whether you're increasing day by day or week on week. And then just thinking at the moment, do you do any regular structured exercise? And this could include things like going to dance classes, playing golf, things like that. So it's just working out where you sit currently. And then the other things that you need to consider is, are you restricted due to other health issues? Many people do have musculoskeletal problems. They have problems with their knees, hips, and backs, which may stop them from performing certain types of exercise. But it's worth just thinking what you've enjoyed in the past, because this might be something that you'd still like to maybe try, maybe in a different format. But thinking about what you enjoyed in the past might be a good starting point. And then just having a kind of look around and see what opportunities are available for you. Are there any classes in your local community? Are there any options to do online exercise classes? And I'll give you some good resources towards the end of the talk. But it's just thinking what's available and what might you like to just give a go to get started. A key thing is kind of motivating yourself to make that first step to becoming more active. And as I've already kind of alluded to, finding something you enjoy is really, really important. If you absolutely hate it, you're not going to carry it on in the long term. So find something you enjoy and try and integrate it into your day-to-day routine so it becomes a habit and not a chore. And if possible, find someone to do it with. So if you can find either a family member, someone to buddy up with, you're much more likely to keep doing it in the long term. Think about your own personal reasons for becoming more active and what you hope to achieve. So everyone will have different reasons. Some people, it might be linked to their NAFLD. They may want to improve their liver health, but it might be something a bit more general, like I want to be able to play with the grandchildren. I'm going on holiday soon, so I want to be able to walk further, to be able to experience more of the sights. Think about what your reasons are and what is going to motivate you to make this change. And it's really useful to set yourself some SMART goals. And what I would say is try and be very specific. Try and set a goal that is measurable so you know that whether you've met it or not. Make sure it's achievable for you and is relevant to you. And give it a time limit for when you're going to try and achieve it by. And what I would say is try and commit this to paper. So even if you scribble it and stick it on your fridge or write it down somewhere, the evidence suggests that you're much more likely to meet that goal if you've written it down. The other thing that's worth doing is just thinking a bit of an action plan. So what are you going to do, where you're going to do it, how often and who, and just starting to think in that much detail means you're much more likely to kind of translate your thoughts about doing it into actions of actually becoming more active. And then the other things to think about is, are there going to be barriers that stop you reaching this goal or stop you becoming more active? What might impede your progress? So it might be that you've decided to go out walking regularly. What are you going to do if it rains? Can you think of a plan B that's going to substitute that walk if it's a rainy day? Or are you just going to go out anyway in the rain? It doesn't matter. It's just thinking about what barriers might stop you and just plans for overcoming them. Because if you've already thought of how you can overcome those problems ahead of the problem kind of raising its head, you're much more likely to be able to overcome it. So these are just some really simple ideas for increasing physical activity levels. And they're things that you can do as part of your day-to-day routine that don't cost anything. It's just a matter of changing your habits. So even things like walking for part of the route to work or to the shops, breaking up your sitting time and standing up and walking for every 1 minute every hour. It might be that you need to set an alarm to trigger you to do that, or you might decide that you're going to use the ad breaks on the television as a trigger to do that. But it's just thinking of ways that you can realistically do it. Things like taking the stairs instead of the lift on occasions, joining a walking group, doing some gardening, things like that. Lots of short bouts of physical activity can be just as good as long periods of activity, and the more done throughout the day, the better. So this is just a summary of kind of those techniques to support you to make and sustain lifestyle changes. And I would just highlight the self-monitoring bit as being something that a lot of our patients have found really, really useful. So if you're trying to lose weight, weighing yourself regularly, because then you know if you're heading in the right direction. If you're trying to change your dietary pattern or the things that you're eating, using a food diary, and it doesn't matter whether that's on paper or whether it's a digital version, and there are lots of apps out there that can help you do that. Or if you're trying to change your physical activity, using something like a pedometer or a tracker on your phone or a physical activity tracker you wear on your wrist, something that you know that you're making a difference and you're heading in the right direction, and you can keep kind of a record of that. So I've just included, these are some really useful online resources that I often signpost people to. So these include the We Are Undefeatable campaign by Sport England, has a lot of exercises and a lot of exercise classes on there for people with long-term conditions. Similarly, you can look on the NHS Live Well website, and it's just got lots of ideas to get you started. And the How Fit Today website has got examples of both chair-based exercises and standing exercises that covers strength training, kind of cardio type exercises and balance exercises. And then there is a section on the British Liver Trust website that just gives you more information around kind of physical activity and NAFLD. So they're all really good resources to have a look at. Locally, if you're local kind of to Newcastle and the North East, there are some partners that we've been trying to work really closely with that provide a lot of support for people in the community if they're wanting to increase their activity levels. So places like Healthworks that are based in Newcastle offer a lot of free classes that aim to help falls prevention. So they offer a course called Staying Steady that you can self-refer to. Urban Green run all the Newcastle parks. So if you wanted to volunteer in the parks, you can look on their website, and there's opportunities to go and help planting trees, keeping the flower beds weed free, things like that. So it's just thinking about what you'd like to do. And these are quite good websites to have a look at. The Newcastle United Foundation offer a lot of free classes, mainly kind of in Arthur's Hill at their big new centre, but they offer a lot of sessions of walking football and things like that. So it's, again, if you've enjoyed football in the past, but maybe don't feel up to going back to kind of running football, they offer a lot of walking football classes. And then I've just highlighted some of kind of the relevant Liver North resources that we've developed over the years. So there's the Non-Alcoholic Fatty Liver Disease Lifestyle Guide that we wrote, I think it was 2016. There's an exercise and osteoporosis leaflet that's worth a look at. And then there's 3 walking leaflets that kind of guide you through 3 relatively short walks, but round the hospital grounds in Freeman and the RVI, or sorry, near to the hospital grounds at Freeman and RVI, and then also a walk in Watergate Park in Gateshead. So have a look at those if you haven't seen them already. So just to leave you with some take-home messages, remembering that physical activity and exercise really are key components of any lifestyle change package, alongside weight loss and dietary change for people with NAFLD. But it's not just about improving liver health, it's also about supporting weight loss and reducing your risk for other diseases. What's really key is to try and tailor the activity or the exercise to your baseline fitness levels, but try and fit it into your daily routine, but make sure it matches your personal preferences. Find something you enjoy, because that's essential for long-term success. Moving more and sitting less is key. It sounds simple, but it's quite tricky to make yourself do that. It's getting into habits of moving around, and as I say, maybe setting alarms to trigger you to get up and have a break from sitting. And just remember, every minute counts. Some is good, more is better. Don't worry if you're nowhere near those physical activity guidelines of 150 minutes of moderate intensity exercise. What you can do is work out where your baseline is and gradually start to increase where you're working from. So it's every minute does count, and set your own goals and try and find something that you enjoy and can fit into your everyday routine. So I'm going to finish there, and I'll stop sharing, and then I'm happy to take questions from you all.
Well, thanks very much for that, Kate. Absolutely fantastic. Can you let me have the slides? And
Of course I can.
yeah, we'll put something from that in the Liver News. Kate mentioned the leaflets. She's collaborated on all of these leaflets. The non-alcoholic fatty liver disease lifestyle guide, and the diet and exercise, and also our new, these latest ones we're doing. Can you see that? This is today's, the last one we've published, Leisure Park, Newcastle, and it's very simple, short walks. And what you do is you walk between the photographs. So there's no great massive undertaking, and there's plenty of places to sit. There's places to stop and turn around, have a drink, and there's lots to see. And these have been done by a volunteer rambler called Alan Curry, and he's doing some great ones. The next one is going to be Exhibition Park, which is an excellent walk, and there's loads to see and do there. I didn't know there was free croquet lawns you can play yourself, and tennis courts, all free to use. And there's after that, we're working with the British Liver Trust to do a walk in Chopwell Woods, a guided walk. So that'll be quite something. So they're available now. There are 3 leaflets available on our ISU publishing site and from the website. So I just want to say one thing before we go into questions. That I was talking to Kate before you all came on board, and I've got some arthritis in my hip, and I had an injection to relieve it. But one of the things that the consultant said, which was brilliant, was to get some exercise. Motion is lotion, and I thought that's fabulous, because if you can get some exercise and move the joint, it helps it to move, which sounds counterintuitive, but that's anyway. So, questions. Can you please stick your hand up if you'd like to ask Kate a question? Thanks, David. Would you like to unmute yourself?
Can you hear me
now?
Hello, Kate. Hello,
Yeah.
Kate.
Yeah.
I'm post-transplant through cirrhosis and PSC, and I'm hoping that what you just described is transferable to myself.
Yeah, I mean, a lot of it is about building up gradually, especially post-transplant. If you've been kind of in hospital for a while and then recovering at home, it's about working out what you can do at the moment and then gradually trying to build up and setting yourself realistic goals. So a lot of it is very transferable. It's what I would say is set yourself short-term goals as well. So maybe set kind of interim goals that you want to achieve in the next few weeks or couple of months, and maybe set yourself a goal for the longer term as well. But I think having those kind of stepping stone goals is a really nice way of keeping yourself motivated, because if you set just one big goal that's for in a year time, I'm going to do whatever, it can often be really unsatisfactory because you never feel like you're getting there. Walking is a brilliant activity. It's a brilliant way of keeping fit, but getting some fresh air, and it's free. And that's kind of why we've done these walking routes around the hospitals as well, is to try and get people that are inpatients in hospital or outpatients visiting, get out there and have a look in the parks and kind of start increasing their physical activity levels. Okay.
One more question, Kate. I'm sorry. Is there something about the physicality of the surgery that means some sort of strength takes ages to recover? So for example, my abdomen, my core strength, it doesn't seem to be improving at all. Will that take the longest time?
I mean, you've had major surgery, and it just takes a long time for everything to heal. So I just wouldn't rush things. And if you're worried about anything, I would speak to kind of your individual consultant and just run past them if there's anything that you want to try specifically. But a lot of it is about just kind of a slow recovery and just taking your time. And it does take a long time. You don't, when you're in hospital for just a few days, you lose a lot of your muscle strength, you decondition, and it takes a lot longer to build it back up than it does to lose it. It's one of those things I think people kind of say quite flippantly, but just a few days in hospital, the amount of muscle kind of bulk.
It's frightening.
Yeah, it is. And I mean, if they measured probably the circumference of people's legs and arms when they went into hospital, and if they'd been in hospital for a few weeks, they'd see the difference in people. And that's why when people come home from hospital, it just takes a long time for you to feel better, if you like.
That's excellent. Thank you very much.
That okay, David? I mean,
yes, thank you, John.
If you email, if you want to, I can put you in touch with people who've had a liver transplant and have recovered.
I'm already sitting on the Monday meeting, so held by Amy.
With the British Liver Trust. Yeah. Okie doke, right. So I think it was Linda and Wally. By the way, to you too, thanks for turning up. I don't know if you're at your London home or here.
Hi, yeah, I tend to go to the gym most days, most weekdays, and I do pretty strenuous exercise, and I'm just wondering what's the sort of heart rate I should not be exceeding.
That's a good question.
I mean, it's different. Yeah, I'm presuming you're not on beta blockers or anything like that.
No, I'm the same as John. I'm about 104 years old.
104.
The program is actually working well, so yeah.
I mean, what I would say is we use a scale called the Borg scale between 0 and 10, and it's been mapped to heart rate, but 0 on the scale is you sitting there, you're doing nothing at all. 10 is the most vigorous exercise you could ever imagine doing, and you would feel absolutely awful. And what we would tend to recommend is that you kind of work between about 5 and 7 on that Borg scale. So you can look at heart rates and things like that, but sometimes the heart rate monitors, I know the ones that I use, isn't that accurate, and often it gives me a heart rate that should be well above my maximum, which I know that it can't truly be. So I would base it on the way you're feeling on a scale of 0 to 10. You can have a look at calculating your heart rate maximum and things like that, but as I say, not all the ways to measure heart rate are that accurate. So I would go so that you're working between about 5 and 7 or 5 and 8 on that 0 to 10 scale.
Right. Is that similar to the range that you get on the machines that talk about METs?
METs is a different thing that measures kind of the energy it takes to perform an activity. There's lots of different, this is where it gets complicated when we're talking about physical activity and exercise. But I would have a look if you want to Google Borg scale, or I can email one out, and it's literally a scale between 0 and 10, and it really is how you're feeling. It's how you perceive how hard you're working. So your 8 will be different to John's 8, will be different to my 8, but it's your rate and how hard you feel you're working. Which doesn't really answer your question, but it's just being aware that a lot of the machines in the gyms that measure heart rate, that measured other things, aren't 100% accurate. So I'd gauge it on how you're feeling rather than relying on maybe machines to do that.
Yeah, I always feel dreadful, but I'm in charge of not the other way around.
But you still keep going, so there must be something in there that's keeping you going.
No, you're not bad for 104.
Well, exactly.
TV camera, it's not telling the truth.
Yeah, so that's good. Is that okay, Wally?
Great.
Yeah, great stuff. So it was Linda and then Peter, I think, was it? Oh, yeah, sorry, Yvonne and Peter. Yvonne, yes, please. You'll have to unmute.
Can I just ask a question before we move on? Sorry.
Sorry, Linda, yes, I'm sorry. Go on then. No, we've lost it. Can you hear me, folks?
So that was all.
You're dropping out. No, can't hear you.
I'll try and ask Kate a question. Can you hear me?
Yes.
Yeah. You mentioned balance. How would you recommend that someone improves their balance? What exercise would be good for that?
I can probably send you some links, actually, or I can send them via John to circulate of some good balance exercises, because a lot of things like standing and doing some exercises behind a chair where you're going up onto your toes, or you're practicing standing on one leg. I'll write a note and send a link with some balance exercises on, because
Excellent.
it's often about challenging your balance, but in a safe environment. So you've got something near you that you could hold on to with your fingertips, but practicing standing on one leg and things like that. And a lot of the things with balances, if you can kind of do general day-to-day activity as well, it helps to increase your muscle strength so that your muscles are nice and strong to help prevent falls and things like that. So general exercise is good, but I can definitely share a link to some balance exercises for you, Linda.
Okay, thank you.
Great. Yeah, that's good. Thanks. Now it was Yvonne, wasn't it? You'll have to unmute, darling. Can you hear me, Yvonne?
Yes, I can hear. Thanks.
Yeah,
Thanks,
go.
John. Can you hear me okay?
Yes, it was perfect.
Thanks ever so much, Kate. As always, Kate's brilliant in getting the point there. So mine's sort of a question in a way, Kate, but I mean, I agree with absolutely everything you're saying. This the bit about you call it individualization, I call it sort of personalization, you know. Now, I've had the benefit of Kate's attention in the past through clinic visits, but I'm at the sort of what was formerly called the NASH stage, and that involves visits to the hospital. So Kate's care and attention to me was through the secondary route. Now, my worry is that all the advice you're giving there, Kate, and it's brilliant. It's perfect advice, and it's advice that is out there, and it's readily available for everybody, and anybody and everybody I would hope would think that everything you said is right and proper. But the difficulty is when you get into the primary, unlike the secondary, you can sort of personalize it. So you can sit with me and you can talk about it and you can encourage and all of those things. And then there's sort of there's a relationship built up as well between me and Kate, if you like, in terms of I don't want to let Kate down either, is let myself down. Do you know what I mean? So how do we sort of replicate that? If you're talking about NASH, whatever name you're going to use, or if you're talking about NAFLD, which is the sort of the second stage, which is usually dealt with in primary care, how do we replicate that personalisation bit, Kate, or can we?
It's difficult, and I mean that's something that we're trying to do, is a lot more education with GPs and practice nurses in primary care to kind of get at least some of these messages across. And I know I'm trying to do some training with other healthcare professionals that work more out in primary care about signposting people onto some of these community providers, because there isn't an army of physios that can do this, but actually there are a lot of things going out there in the community. We just often don't know about them. So it is difficult, and the GPs and kind of practice nurses have got a tough job because they're trying to see people a lot more people. But I think if we can do some education and maybe provide packs of key resources that you could signpost people to, it might not have the level of personalization that you get in secondary care, but at least it's a start and people are getting something. The other thing that we're looking to do at the moment, we've got a digital intervention for patients with NAFLD on trial enough. It's called Vitalize. And that's proven in the pilot. It's looking like that's quite encouraging. So what might happen in the future is we might be able to roll that kind of digital intervention that has coaching built into it into primary care. But we're a long way off that yet. We just don't have a NAFLD version of these structured education programs, which they do have for other diseases like type 2 diabetes. You might get sent to Desmond, but we don't have a Desmond for NAFLD yet. So we are working on it, and we're aware that this is a massive problem. It's just not a problem that's easy to fix, unfortunately.
I sort of get that. And the thing is as well, with the GPs, Kate, I mean, I know you're saying they've got a lot more to do, but quite often that's over the telephone, and you know, that's difficult in itself.
It is, and I don't think often you don't see the same GP each time, so there's not that continuity. You don't build that up, that relationship. They don't know your story or your background, so it is a problem. And we're trying to look at what other options might help with kind of the lifestyle related care, whether it be having more health trainers linked to primary care, training social prescribers to do a bit more around physical activity and exercise. We're trying to look at what other options might be out there in terms of staff that are already in place that could maybe take on a little bit more of this messaging. But as I say, it is a massive problem, and it's going to take.
Yeah, I know. Sorry to interrupt, Kate. To me, the answer is definitely in primary care when it comes to this particular part of dealing with NAFLD, isn't it? Yeah.
That's good. Is that all right, Yvonne?
It is. Yeah, John, I'm just frustrated because things are not happening quick enough.
Well, I know it's awful, but I was going to say that we've been around a long time, and we've seen this kind of thing. It worked very well with brief intervention, where people didn't want to let each other down. You know, the clinician or the nurse and the patient didn't want to let each other down, and it works with Peloton. The people who would do this, they're running a bike and there's a guy on the other end, or it's just a video, but it's a good thing. We could talk to you about that, Kate, if you want to think about doing something on that.
We've done something similar in patients with liver cancer, where we've been looking at delivering virtual exercise in a class format to patients with liver cancer through Professor Helen Reeves. And that proved really successful because people wanted to turn up because there was a group of people waiting for them. It was a live interaction. So there was someone there that could kind of talk them through the exercises. So ideally, I'd like to start doing something like that for NAFLD. It's just where you start and how you get the funding to do, something. But it is something that we've got on our radar.
You can always knock on our door, you know that. It's a good cause, and NAFLD's coming, it's endemic. And possibly epidemic. It's everywhere. So thanks for that, Yvonne. Pete, sorry you've been holding your hand up a long time. Our gold medalist.
Well, first of all, part of that's down to Kate, because when she first met me in 2015, I weighed nearly 26 stone at NAFLD and was inoperable. I couldn't have gone to a transplant. I lost 9 stone to get the transplant, and that was through the exercise and fitness programs that she said. Just
well done.
What Yvonne said was the commitment between Kate, when you're seeing her every 3 months, or something like that at clinic, that's one thing. But I found that wasn't enough to motivate me. I actually agreed with 2 friends. One friend on a swimming pact that we would swim 3 mornings a week, and that was really great for me, because on the mornings, when it was raining and cold in the winter, and you got up and you looked outside and said, I don't want to go, I knew that my mate Frank was waiting for us to pick him up that day, or he was going to collect me. So it got the motivation to get out of bed and do it, And then I did it with another lad on cycling who'd had a heart bypass, triple bypass, and he was trying to regain his fitness. And what we tried to do was, again, not always paired together, cycle together, because he lives in a different place, but we would compare how far we'd cycled that day. And actually, sometimes he got up and said, well, I'm going to beat Dave this week. So it's rotten outside. I'm going to put my wet gear on and pedal 10 more miles so I can beat him this week. So I found that really helpful, of creating relationships myself to spur myself on. And that was something that I thought really worked really well, as well as going back to see Kate, obviously.
But I completely agree with you, Peter. It is about having people around you as well that are going to support you to do it, and that they encourage you and motivate you, rather than kind of them creating barriers for you as well. So having some kind of buddy, or like you say, it doesn't need to be someone that you see all the time, but it could be just having that competition online or by the text that you're doing 10 miles and they're doing 12 miles, that just spurs you on a bit more. But I know for me, I quite like exercise, but I like exercising with my friends more. So I know that I've got a netball match tonight and I know I'll go, whether it's raining or not. Whereas if I was going out for a run on my own, I'd quite happily not do it. So it is something about not wanting to let people down and being part of a group. So yeah, it's definitely a really good tip.
It's addictive, doesn't it? After a while, it becomes addictive. So people in the Freeman Ward 38 will tell you about the nutter who got on a bicycle 5 days after his liver transplant and tried to have a go and spread the contents of his drain bag across the wall.
I know.
It physically becomes difficult to sit still and not go on the exercise. You get to a point where if you don't do it, you feel lousy, so you get on with it. So it's a good thing to do.
And there is a lot of evidence that shows that it really does help your mental health. It helps with depression, anxiety, and it lifts your mood, and you get all these endorphins released so sometimes it's just getting over those first few barriers and making those first few steps, then it does start to feel a little bit more enjoyable. So yeah.
Excellent. Thanks. Is that okay, Mike? Peter, sorry, you happy with that?
Yeah.
Very good. Great stuff. Sean, you've got a question. You'll have to unmute, Sean.
Thank you. That was really interesting, Kate. Great to hear what you've been doing. I wondered whether there are any other organisations you could work with. One of my family has Parkinson's disease, and at the time when he was well enough, he used to have sessions every week online with the Scottish National Ballet.
Oh, wow.
Yeah, they specifically ran sessions for people with Parkinson's. And so I just wondered if there was any, or perhaps there might be some organisation like that.
Yeah,
that would be able to offer something.
Possibly. I know we're trying through a different project that I'm working on called Active Hospitals. We're trying to work a lot more kind of savvily, if you like, with community partners, because we have realised that actually we can't do it all within the NHS, and some people in the community are better placed to be able to support people closer to where they live. They've often got better facilities as well, so it might be worth exploring like some of these other avenues as well. So thank you for that. I might drop someone an email.
Sorry,
is that okay, Sean? You want?
Yes, I was just sorry, John. I was just going to add that Age UK North Tyneside do lots of stuff.
Yeah, they do. If you look on their website, there's loads of stuff advertised. Yeah. There is lots of stuff out there. It's just people knowing about it sometimes. But their classes are really well organised.
Yes. Well, we'll be putting the links in the newsletter when you send us them, Kate, to help people. So is that okay, Sean?
Thank you very much.
Alf got a question? You'll have to unmute, Alf. There we go.
That it? Okay.
Yep. Perfect. Can hear you now.
Thanks for that, Kate. Fascinating talk. I mean, you've talked about giving plan A and plan B, but it sounds to me like you've actually given almost X, Y, and Z with your personal approach there. One of the things I've actually found very, very useful is this idea that Michael Mosley, who's done a few programs on BBC about exercise stacking, where you do small amounts of exercise on a regular basis. Does that fit with, your idea of actually improving the health of people with liver conditions?
I mean, we have done some work looking at high intensity interval training in patients with NAFLD. Given that our HIIT training was more modified than what Michael Mosley often does, because often his is very extreme in that he probably exercises for a few seconds and pretty much to his exhaustion, and then whereas ours was a bit more modified, taking into consideration other people's comorbidities and the fact that they might have cardiovascular disease and things like that. So there is work out there showing that it does help. What I would say is, alongside that, it's still important to think about what you're doing the rest of the day. So even if you do a short burst of intense activity, if you're then sitting for 23.5 hours or like, it kind of undoes the good that you've done. So it's worth thinking about the structured exercise, but also worth thinking about your general day-to-day routine and how you can maybe make small changes to increase your activity over the whole course of the day, rather than just focusing on an intense 5 minutes or whatever. So like there is some evidence there for people with NAFLD that high intensity training does work, but it doesn't look any more beneficial than any of the other types. So it's more finding what you like, and a lot of people don't like the thought of doing this high intensity exercise. They prefer to do maybe more of a continuous moderate intensity exercise for a longer period of time.
Okay, thanks.
Good. That okay, Alf? Great. So that's about it, folks. And I'll just talk to the people now who are watching this video afterwards. So you've probably got lots of ideas, folks. So if you get in touch with us, info@livernorth.org.uk, we'll be able to pass on any of the information that Dr. Hallsworth sends us. Okay. And thank you everyone for coming and for turning up. There's 14 here. So there's probably about another 40 ready to watch this as soon as it gets made available on our YouTube session. So that's it. And thanks very much, Kate, for coming along, giving us your time tonight. Very, very worthwhile session. I think everyone agrees.
Excellent.
Brilliant session. Yeah. So excellent.
Thank you.
Thank you.
Thank you for having me.
Enjoy your netball.
Thank you.
Yeah, okay.
Thank you.
Right, folks, I'll stop recording and I'll say goodbye.